Hey, welcome everybody this afternoon, or from whatever time zone you are joining, to this afternoon's webinar from ICPSR. We are really pleased to be talking about ways to work with ICPSR and how to designate ICPSR in an NIH data management and sharing plan. With that, I will dive right in and get started. So I'm going to start with a little bit of an overview of the new NIH, the National Institutes of Health, Data Management and Sharing Policy that is going to be rolled out on January 25th and applicable to all grantees. This is a data management and sharing plan policy change that NIH has instituted and has provided a wide range of webinars and information sessions and website materials to alert its community that grantees proposing research projects will be required to submit a data management and sharing plan if they're proposing something new to NIH on January 25th or thereafter. The idea behind the policy is to make more concrete and clear NIH's expectation that researchers maximize the appropriate sharing of scientific data they collect in the course of their NIH projects. And so the in practice saying is that all data will be managed and most data collected with NIH funding will be shared. The data management and sharing policy at NIH will apply to, as I said, all projects submitted January 25th or later, and those that generate scientific data. So of course, there would be some proposals and projects that didn't lead to the generation of scientific data that would not, this would not apply to. But it does apply to both extramural research originating outside NIH and also the intramural research program, and also includes the small business innovation research awards and the like. It covers all data that are collected that are required to either validate or replicate findings. So not just necessarily the variables that underlie publications, but all findings reported in the course of a project. This is obviously a departure from the past policies that we've been familiar with at NIH, where there was much greater latitude and flexibility that would allow research projects to not have to share their data through repositories like ICPSR. So here, a big change is that data that are produced in studies that are even small or narrow would be shared. Justifications about the interest in sharing data would also not be applicable. So even if something was of potentially low interest to the broader community, it's still important to share from a replication or transparency point of view. And even when there is no logical repository for those data. And to that end, NIH has produced a list of generalist repositories to catch the data that don't necessarily have a domain repository home, like ICPSR. So the requirement itself is a data management and sharing plan. It's a 2-page plan that will be submitted with all research proposals. And of course, the idea behind the data management and sharing plan requirement is that it would reflect a great deal of planning and scoping on part of research investigators and teams to make plans for the data that they're going to produce. Plans about storage, plans about documentation, plans about the long-term preservation and access to those data that, again, reflect NIH's values around transparency and ensuring that the data are reusable. So that's good to say. It's often easy to think about wanting as a researcher, wanting to have some easy text to meet the requirement, check the box, and move on. But really, this is more successful when it reflects concerted and intentional effort to think about how data can truly be usable, both by the research team while they're collecting it, and then subsequently by the broader community of those who might be interested in accessing the data. The actual two-page plan has several required elements that investigators would be writing about, and the point of today's presentation will be to familiarize yourself with ICPSR services so that it's possible to answer and provide information about elements in the data management plan that reflect how ICPSR can be helpful in being a partner with investigators when the data are planned for deposit and access through the ICPSR repository. And I'll talk a bit about what fits and doesn't fit ICPSR as well along the way. But the major plan elements are the type of data that will be collected, as well as software and code, so descriptions of those things. Any applicable metadata standards that will be used to ensure that the data are accessible. So for example, at ICPSR, we follow the Data Documentation Initiative standard, as well as, importantly, the fourth element listed here, information about how the data will be preserved and accessible and the timeline for that. And here in this section is where researchers are able to designate a repository, a planned repository for their data. So it could be ICPSR, it could be another domain repository, it could be one of the generalist repositories. If there are any access, distribution, or reuse considerations, so if the data are sensitive, if there are regulations around how the data can be shared and accessed, any of those would be described in the fifth element area that's described here: access, distribution, and reuse considerations. And then finally, a description in the plan of the roles and responsibilities for those who will have oversight over research data management and subsequent data sharing. So as promised, I want to start by talking a little bit about knowing whether your data might fit the services and repository at ICPSR. We obviously are a long-standing repository that has served the social and behavioral sciences, as well as many NIH collections over the years, NIH collections that have content on social, economic, behavioral characteristics of human subjects and how that affects subsequent health outcomes, but really from a really wide range of disciplines. And so ICPSR has support for a broad set of disciplines that might be interested in safekeeping and making accessible their data through our repository. There are also, ICPSR has interest and ability to help a wide range of data formats. ICPSR is often known for quantitative data files or perhaps qualitative text data files, but ICPSR has been the home, or is the home, for other kinds of data formats as well, whether it's video data or geospatial data or administrative data. So for more information on the extent to which a planned study might fit ICPSR's scope of what we would accept, I want to direct you to the ICPSR collection development policy. And so there's a tiny URL there where you can type ICPSR-CDP, and that's where you'll find more information about disciplines and data formats and the boundaries of ICPSR's collection. So I want to move to part two of this roughly four-part talk. and talk a little bit about how to designate and why to designate ICPSR in your data management and sharing plan. The NIH has extensively outlined the types of characteristics that are desired in a repository that you would select as an investigator as a home for your data. And so I'm going to talk about each of these major areas of desired characteristics of a repository and a little bit about the flavor of how ICPSR meets that characteristic. So the first is use of persistent identifiers. And this is really important because persistent identifiers are what are used throughout the other outputs related to data, like publications, and can be associated with the grant application back to the data, the publication to the data. It allows for all of the dots in the ecosystem of a study to be connected when the same persistent identifiers are referenced from a part of a study to another part of a study, so data to a publication, for example. ICPSR, when it is publishing data, assigns a persistent identifier to that study. We use a DOI, a direct object identifier version. This is also part of the recommended data citation that we present to any users of the data. As people reference the data that they use in subsequent analyses, it allows any user to come back to the study homepage where the data live. And so that's where that connectivity between the research lifecycle and ecosystem resides. We maintain that study homepage and an explanation for those data, even if we were to deaccession the data, which is another requirement of NIH that I'll come to. But even our deaccession studies present information to users about what happened to the object should it have been taken down. And so this is avoiding the problem of a broken link and following a link to a web page where just nothing exists. This will give the user information. Another characteristic of repositories that are considered best homes for NIH data is to choose an organization that has a reputation as being able to sustain the data over long periods of time. So long-term organizational sustainability. ICPSR turned 60 this year. And so the original studies that were made available through ICPSR remain available today, 60 years later, weathering technology migrations and data format migrations. And so ICPSR is a proven organization in the sense of maintaining collections over time. And we look forward to doing that with increasing amounts of NIH data as well. In the more modern version of long-term organizational sustainability is reflected in our Core Trust Seal certification as a repository. And so that is a process and a body that certifies organizations as having thought through the right policies and practices to keep data for the long term. And so we have met that certification and precursor certifications to the Core Trust Seal since we've been through that process for many decades. Part of the plan for an organization is to have a plan to transfer data to a partner organization should the organization close operations, and we have the inter-organizational agreements with other repositories to back up each other's collections in those kinds of ways, giving more permanence or more assurance of permanence to the data files that we archive. Another characteristic of the ICPSR repository is how we think about and manage metadata. All the data that we make available are accompanied by metadata, which is information about the data that can enable a user to discover it, to reuse it, and to cite it properly. We maintain metadata, as I'm describing it, for lots of different levels around the study. The meta level, the study itself, information about the citation and the methodology, but also file level and variable level metadata about the elements of a data collection that allows, again, for researchers to discover not just a study they might be interested in, but a variable they might be interested in. The metadata standard, as I mentioned, that we adhere to at ICPSR is DDI, the Data Documentation Initiative. It is an XML markup of our data elements, whether they're at the study level or variable level. There's a lot of standardization and consistency on how we present information about studies and files and variables. We make use of controlled vocabularies, but again, allow for consistency in finding those elements of collections. Our metadata records are curated and produced, but also reviewed by a metadata archive specialist at ICPSR. And so we have the expertise of archivists who specialize in metadata to ensure the quality of what we are doing. More on curation and quality assurance that you can talk about in your data management and sharing plan is the tools and guidance that ICPSR provides to investigators or researchers who wish to deposit data with us. So we do a lot of help and outreach to the community wishing to use our archives so that they can compare the data so that it is potentially findable and reusable. But beyond what we expect of the researcher who's depositing data with us, we also have a very large team of expert data curators who have ICPSR tools and other tools and processes that help them review the data packages that come to us to provide additional organization and documentation, where they are essentially the first users of the data, right? So a data curator would open a package and be sure that all the elements are there for a user to understand how to use the data and what its limitations might be. Our data curators, in addition to that curation process, follow a strong quality assurance process with multiple levels of quality of review of their work by more senior curators and supervisors. It makes for a very nice end product. Another aspect that NIH is interested in repositories where data go are free and easy access to the data. And here we are really proud at ICPSR about our record and our ability to provide broad and equitable and maximally open access to data sets and metadata. And obviously there's sometimes limitations to data sets based on the sensitivity of information that's shared where something has to be restricted. But by and large, as open as possible is part of what we do at ICPSR. ICPSR, in terms of the free part of access, has several NIH-funded repositories where NIH data deposited through those specific deposit and release mechanisms at ICPSR means the data are free to all users. And that is where we have sponsored support from an NIH institute to curate and improve and release the data. For data that are deposited and curated by ICPSR, this also fits the free and easy access in the sense that data are free to members of ICPSR and non-members pay a small fee to access data when those data have been provided by membership. And so here it is possible for really broad use in a sustainable way to data sets that ICPSR itself is making available. And ICPSR does accept and curate NIH data under this provision as well. And then finally, it's possible for you to budget as an investigator ICPSR's curation services to ensure that there's no cost to any user for accessing the data. And so those are the commitments that ICPSR makes to the accessibility and wide use of its data, and ways that we can work with you to ensure that it happens. One of the things that NIH is providing information and expectations around are the kinds of costs that are allowable related to data management and sharing. And while there's, it's possible to budget for data management costs and advisable for local data management costs like storage and somebody to prepare the data for use at the local institution where the data are collected. It's also advisable to put into your budget costs associated with curating and preserving the data for the long run. And so if that's a particular condition that you're interested in, ICPSR can estimate the cost of its services based on a description of the data that you provide to us. And I'll talk a little bit more about that when I come to a resource page that we have where you can find out more information. ICPSR is very much looking towards tracking and measuring the impact of data and how the data are reused. We do make our data sets and metadata available using the broadest possible terms of reuse that still protect human subjects' privacy information. Our terms of use do not allow for redissemination. And so if you are a user of ICPSR data and wish to disseminate it to a research community, that wouldn't be allowed unless you sought and gained approval from ICPSR itself, and there's a process for doing this. I also want to show you a bit about how we are tracking use. This is the Charleston-Hurt study, a study that we've made available from ICPSR for decades. These data are restricted use data, but the code books and metadata are available as public use files and so can be downloaded for a user who might be looking to examine what's in the data before applying to access the restricted data. You can see quickly from this snapshot of the study homepage that the data have been downloaded 229 times, the data, the code books have been downloaded 229 times over the past 3 years. And we have associated and tracked 58 publications as being related to the Charleston-Hurt study. Again, this tracking is possible in part because of the data citation that we make available. So this is how to cite the data, a pop-up box that comes up for the user, as well as a citation that's part of the code book and metadata that are part of the package that a user is able to access when they gain access to the data or download a public use code book. And it tells the user the citation for the data, the credit for the researchers who collected the data, and importantly, the persistent identifier at the end of the citation, the DOI. And that is how we resolve back publications related to our data sets at scale. Another aspect of the work that we can do on your behalf is to take data files and present them in as common a format as possible for users to use. So for a quantitative data set, we distribute data files in 8 data formats, and those are listed there, including things like SPSS, Stata, SAS, but importantly, also different plain text formats. So accepting image data and video data, virtually every data file at ICPSR is available in a plain text format. And so this describes our commitment to presenting data in as common a format as possible, which helps for both preservation and also a user who may not have access to a particular software package, but would like to examine the data. Provenance is also something that we think about and make provisions for on our study homepage. Studies get updated and changed over time on occasion, and ICPSR retains those earlier release versions, keeping those available, version number 1, 2, 3, and so on. We provide a text description of what's changed from version to version and timestamps for those changes so that it's clear when they occurred. And previous versions are kept and can be accessed upon request. In terms of our retention policy for files, we do consider ourselves as a permanent home for data files that are submitted, both those that are deposited as well as the curated versions that we would release. It is possible to request the ICPSR deaccession data, and there's a policy for that. But we would still preserve the actual underlying data files, even if they were not accessible to the public. Digital files are always assigned, as I said, a persistent identifier, and the description would remain available to you even if it was deaccessioned, which I think I mentioned before. The last 2 parts that I wanted to talk about that is of interest to NIH that ICPSR works on. One is our deep commitment to maintaining the confidentiality of human subjects that underlie the data that we manage. We have a data stewardship policy committee that helps set policies and guidelines around providing access to sensitive and disclosive data. We have a data privacy and security officer, and that person has a team, a security team, to provide security and data stewardship and governance around data sets and allows for users to access those data. We also have a disclosure review board that helps set guidelines around what is disclosive and what is not, or if there is ambiguity around how we might manage a particular collection that comes to us. That is a resource that we have to keep our work at the highest standard. ICPSR's data curators themselves who process and review the data are all trained and supervised in disclosure risk review. The data curators are following ICPSR's standard and disclosure review guidelines that we've created, and those take into account as appropriate any legal or other obligations that we have that accompany the data when they are deposited at ICPSR. So if it's a data set that has PHI in it, we would attend to managing the data appropriately. So around the human subjects data that we're managing, because by and large, that is the entirety of ICPSR's collections, we do authorize all users who wish to access data. If it's a public use data set, it is agreement with terms of use and a registration process, so pretty lightweight. For a sensitive or disclosive collection, we manage access and authorization of users using a data use agreement that we would manage. We have different tiers of managed access to restricted data sets that I want to mention. Some data are restricted but can be downloaded and used locally at a user's institution once they have that data use agreement and a data security plan. For other data, we retain them within our system at ICPSR and make a virtual data enclave window available to users to do their work. And that is obviously, as well, requires a data use agreement on part of the users and other safety and security controls that we manage. And then finally, we do have an on-site option, a physical data enclave with a data use agreement. Part 3. So this is a bit of a shorter part. I want to talk a little bit about some of the NIH-supported repositories at ICPSR, and we have 3 NIH institutes that have repository infrastructure that is part of the ICPSR home. So one is the National Institute on Aging, the NACTA archive, the NICHD, supported Data Sharing for Demographic Research Archive, and the NIDA-supported National Addiction and HIV Data Archive programs. And one of the things going forward that grantees will see from time to time in funding announcements that they might be replying to is a listing of an intended home for data sets for a particular call or funding announcement. And some will say that it's expecting its grantees to work with one of these NIH-supported repositories at ICPSR, or others designated, but not at ICPSR as well. So here's the homepage for the Aging Archive, a homepage for the Data Sharing for Demographic Research Archive and the Addiction and HIV Data Archive program. I wanted to just move quickly through those and show you this chart. It shows you the funding source of each of these repositories and when they were established. The Aging Archive was established back in 1984, the DSDR Archive in 2004, and the new kid on the block, the Addiction and HIV Data Archive program, which was founded in 2009. There you can see as well descriptions of the number of studies that are available in each of these repositories and the number of variables, as well as the publications, the impact of the data that we've been able to associate back with the data. Some of those would be collected by the investigator or published by the investigator who collected the data, but also this includes any reuse of the data that we are able to identify. In terms of the some of the most popular studies in each of these archives, the MIDA study is a very popular midlife study in the Aging Archive. AdHealth, the National Longitudinal Study of Adolescent Health, is a heavily used and downloaded study from the Demography Archive, and the Population Assessment of Tobacco and Health is a popular study from the Addiction Archive, just to give you a flavor of what's there. These projects not only archive data and promote the use of data, we also conduct outreach directly with the research community to make people aware of the archive services that NIH is providing. We're at places like the gerontology meetings, the population meetings, APHA, American Public Health meetings that will be happening next month. And then in the NADAP area, the Society for Research on either Child Development or Adolescence, and Society for Prevention Research, and many others. That gives you a sense of where you might meet one of our repositories. We are also working with NIH funding to solve other data challenges that I just wanted to mention quickly. We are coordinating a series of research projects, social, behavioral, and economic research projects that are looking at causes and correlates and consequences of COVID. We're coordinating the data collection and analysis efforts and dissemination of these wide group of research projects in a consortium. And so there's a website for that project to find out more information about SBE kinds of data sets that are in the COVID arena. We are also working with NIH funding to do a analysis and a research project around what are the challenges to sharing qualitative data that are collected under the various institutes at NIH. And to that end, we've actually established a workflow and a repository to de-identify qualitative data collected with NIH funding. And we will have 30 qualitative data from 30 studies, NIH studies, available through this particular page. I think we have 21 studies currently to date, and we're coming to the close of that, so the remaining ones will be released in short order. But that gives you a sense of not just quantitative data that ICPSR or one of these NIH repositories has made available, but also text and other kinds of data, which can be a little bit trickier to share, but doable and possible as well. So I want to end with where you can find more information on the work that we're doing at ICPSR and making a determination on designating ICPSR in a data management and sharing plan that you might be putting together. We have a resource page at ICPSR, so the tiny URL ends in ICPSR-NIH. We can also get to it from the shared data top level navigation button on the ICPSR homepage. If you click on the shared data button, there's a drop down for sharing NIH data. It'll give you information about NIH supported repositories at ICPSR that I've just talked about, and some others as well. It also points you to help on how to put together a data management plan that reflects these sterling qualities that I've described to you about ICPSR. We do have research data management help available from a website at a web page at ICPSR that you can get to from this NIH page. But we'll be having more tailored text about ICPSR services to include in your NIH data management and sharing plan coming soon. So right now there's generic help that you can use in any DMS plan that you might be writing, but we'll be refining that based on the guidance that's coming from NIH as best as possible. Also from this website, you can request help. You can certainly just write to us at the ICPSR help desk, which I'll show you in a minute. But you can also get help on estimating our services for a budget that you're preparing. You can also request a meeting with us to talk about a research management and sharing plan that you might be thinking about writing, or a proposal that you're considering, so that you can begin to make some plans and decisions around the data that you might be collecting, so that they are shareable down at the other end in the time frame that NIH is looking for the data to be shared. So both good to know about. So here is a really quick look at a lot of the team members that we have helping with that kind of consultation. We have ICPSR acquisitions team members, Kirani and Brene, but then also these dedicated NIH repository data project managers, Catherine, Sarah, and Chelsea. So I wanted to put them out there in case they are one of the people that you end up talking to. Be prepared. So finally, I'm going to end by opening up for questions, but also I want to thank you for staying with me through this presentation. I want to invite you to connect with us in a myriad of ways. If you're on Twitter, here's our Twitter handle. ICPSR is also on Facebook and Instagram. And if you just simply have a question about this process, you're welcome to just email the ICPSR help email address that's listed here as well. So with that, I'm going to turn to looking at any of the questions that have come in. So I welcome you to add a Q&A question, and I will work on answering those. If you haven't yet, I'll give you time to type those in. We have a first question. Do you imagine the number of studies to rise significantly as a result of this change at NIH? Yes, I think we're expecting, so it's kind of interesting. ICPSR, as I said, has a long relationship with NIH. We probably have well over 1,000 distinct studies that were funded at NIH. And so we've always been one of the places that grantees who are working on data that have social and behavioral implications and flavors to their work have thought to deposit data, either in one of those designated repositories or an ICPSR at large. But beyond the people who have just found us, we expect that more people will be thinking about data sharing through repositories because of the requirement. So that alone is likely to increase data coming to ICPSR. And that's part of the idea behind this webinar. We want to get the word out so that people who are collecting the kind of data in our domain know to find us and know to contact us so that we can be part of the early planning process and ensure that the data do make it into a repository like ICPSR and truly then accessible. I'm going to look for another question. So I'm getting a question about the main benefits of budgeting for ICPSR's curation services. I think that's a really great question. We have always had, or not always, but for a number of years, we've had people who have budgeted for and paid for curation services, even outside of this new NIH policy requirement. We find that people come to us and want to be sure that the data are freely accessible at no cost to the broadest possible audience. The fee for accessing a membership data set is quite low. It's $550, but for those who consider their data to be of interest to an even broader group of users, perhaps data that might be used outside of the places where ICPSR has deep membership representation. So most research institutions, universities, research-focused universities in the US are members of ICPSR, and so that community is very well served with the ICPSR membership data that we make available. But for data sets to be accessible at no cost, even broader, that is when you'd want to budget for ICPSR curation services. So there's also a service called Open ICPSR that I have not talked about. So we have a question about the role of Open ICPSR in terms of holding NIH data. Do you prefer that studies are directed towards ICPSR and funding budgeted to make it open to everyone? So it's possible to self-publish data in Open ICPSR today. Self-published data are made available in the format that researchers have put the data, prepared the data and documentation. And so there's a lot of variability in Open ICPSR about just how usable a data collection is. It's the home to lots of replication data. So from my point of view, Open ICPSR is best for replication data. So a more narrow subset of a data collection. I'm a proponent of ICPSR's curation services because it really does create a level of usability and quality that's consistent with what NIH is looking for, and also what a repository thinks is truly fair and accessible data. So the FAIR acronym is findable, accessible, interoperable, and reusable. So Open ICPSR is a place to self-publish data. I can tell you that the Aging Archive, the NACTA Aging Archive, does have an Open ICPSR related collection that allows for it to serve as a home for more aging studies than the resources that it has to improve and curate and ensure the quality of data that come into the main Aging Archive. And so it's sometimes a nice synergy for to have some data sets coming in through Open ICPSR. Hope that doesn't sound too equivocal. Wait and see if there's more questions that come in. Please do type your questions into the Q&A box so that I can answer them. Yes. So another question about when we can expect templates for the NIH policy. ICPSR currently has drafts of template language that we've been working on. I expect that before the end of the year, and certainly before the policy goes into effect on January 25th, we will have a link available to template language about designating ICPSR or one of our NIH repositories available for you. Question coming in. I'm not following this question to the user or to the audience member who's asking about the data enclave. I can tell you that ICPSR has a virtual data enclave access channel and a physical data enclave. The virtual data enclave contains a place for users who are authorized by ICPSR to access restricted data sets through a virtual window. The virtual window is has capabilities for the user to use SAS and SPSS and other statistical packages to analyze the data, but doesn't allow a user to download those underlying data or microdata. Instead, a user performs all analyses, alerts ICPSR when they have output for us to review. We will take a look at that output. One of our staff researchers who vets the output ensures that there's no disclosure risk in the files. And then we allow and authorize that output and send it to the user to use in their publications or presentations. The physical data enclave works as well, but it's a monitored environment. So there's an ICPSR staff member who's in the physical data enclave while somebody comes in, works on a computer in that space that also is not connected to the internet. And there's a disclosure review performed on output that's taken out of the physical data enclave as well. In both of those instances and in the secure download option, ICPSR users request access to restricted data and provide information to us, and their institution and the University of Michigan sign a data use agreement about the obligations the researcher is under as they analyze the data. And so the data use agreement is similar, but not exactly the same for secure download versus the virtual data enclave versus the physical data enclave. Right. I think I've answered these questions. So Brene has been nice enough to put the link to the resource page that we have for those looking to work with ICPSR or to share NIH data with ICPSR. So I welcome you to review that page and bookmark it and come back to it. This was just our beginning effort to consolidate some of the information and point you in the right places on the vast ICPSR website, so that you're in a position to engage in good research data management practices that can enable data sharing where possible. And also that information will grow over time. So please do bookmark it and come back and check it out in the future.
Yes.
Yeah.
Thank you so much, Amy, for your presentation today and for all of the helpful information. I don't see any additional questions in the chat, but if you do have any additional questions, like Amy said, you can reach us at icpsr-help@umich.edu. And we will again have these slides recorded and sent out to you as soon as possible. So thank you everyone for attending, and thank you again, Amy.
Thanks, Brene. Bye, everyone.